Now, are there certain therapies? I mean, I know there's a lot of therapies out there. Are there any that you recommend or any that are especially beneficial to children with juvenile arthritis?
I mean, you mean in terms of like physical therapy or occupational
Correct,
therapy,
yeah.
that kind? Yeah, I think they all are. And part of this is individualizing the treatments.
Correct. Mm-hmm.
The first thing we have to do really is to get the inflammation under control. Because if we don't do that, the child is not going to do anything else because it's going to hurt too much. I mean,
Right.
you know, kids aren't stupid. They're not.
Right.
Well, I'm supposed to do this, and so therefore I will, even though I know it hurts. I mean, it's like that's just silly. So the first and foremost thing is to get the disease under control, and if there are any contractures or which is when a joint gets stiff and gets stuck and you don't have full range of motion, we're going to work very hard on trying to get that joint to be able to move. Once the child is certainly comfortable with that, so we'll use a lot of splints and various other techniques from therapists to help out with that. For example, a lot of kids will have issues with their fingers, where their hands will sort of get stuck like this. We can use some splints on their fingers to help straighten them out, or have them sleep in some splints if that's a problem. So they'll get 6 or 8 hours with their hands extended. Because if you don't move it, you lose it. Once you get people feeling better and the kids are able to resume their usual activities, that usually is a much better way of getting any kind of therapy than something formal, which becomes more like homework. The problem is that we also need to make sure that we're pushing kids enough to make them become more active. I mean, it's a problem for all children in the United States. But when you have something like this, you start remembering, well, if I started doing this, it started hurting a lot, so I want to stop earlier, or folks get deconditioned. And so some of this, to me, is more of a training issue rather than a therapy issue. That we show folks it's better to move this way because it's going to be easier on the joints, it's not going to bother you as much, and then start trying to guide them into back into their normal activities. My goal for everybody is I want all the kids I'm taking care of to have all the same problems everybody else their age is having, and not much else.
Again, we're talking with Dr. Gewanter, down from Richmond, Virginia, pediatric rheumatologist, Dr. G, as we've been calling him during these last 20 minutes or so. Again, if you have a question, please email that to us at chat@wrgb.com. As Dr. G alluded to before, there is a shortage of pediatric rheumatologists across the country. So this is really a fine opportunity for any parent, young person that has juvenile arthritis that could ask a question. Dr. G, from your opinion, how are you foreseeing kind of the future? If you had that crystal ball, if to say, with the Arthritis Foundation in the area of research, what is our time frame of looking at? Will we see a cure for juvenile arthritis at some point?
I think we are. I'm pretty confident that we're going to come up with cures for some of the forms. Maybe not all of them, but the changes in the last 5 to 10 years have been just remarkable. And so, my time frame is off, but I don't think I'm off in the concept. We are getting better and better interventions and learning more and more about where the targets are that we need to intervene so that we can treat the aspects of these diseases that are causing problems and hopefully have minimal downsides from not having collateral damage to other cells or other organ systems. When I first started, I always used to joke that I was like trying to do microsurgery with garden tools, and now we're sort of getting down to microsurgery with microsurgical tools, and really starting to look at a lot of the fine tuning. So the biologic agents that we've been using, again, Enbro, Humira, Orencia, Actemra, these are all been approved for use in children. And there's a variety of others, and there's new ones that are on the horizon that I just feel very confident that even if we can't cure it, we're going to be able to control things well enough that people are going to be able to get on with their lives and expect to live a normal life with minimal interventions from this. But I think the other thing that we just also need to mention that we've been learning a lot more lately about arthritis in general. This is both with adults and children. Is that these are chronic inflammatory conditions, and if your body remains in an inflammatory state, there are a number of other secondary things that happen. So, for instance, with adults, we're learning that a lot of heart disease and other issues related to that are much more common in adults with rheumatoid arthritis because those are inflammatory diseases. So the more aggressively and the better we can control the inflammation, we're not only helping the joints, but we're also going to be helping out in many, many other organ systems that we don't usually think about.
I was reading the other day, I know there's a Kids Get Arthritis Too newsletter that comes out, and Eileen and I were actually talking about it the other day. We read about this term, and excuse me if I mispronounce it, but spondyloarthritis. Are you familiar with this term, and can you just elaborate a little on that?
Sure. It's spondyloarthritis is a type of arthritis that primarily involves the spine and the sacroiliac joints, or the central parts of your body, as compared to the peripheral joints. It's more often seen in adults, at least in that form, but a number of kids will get that as well. But the other thing that will happen is many of the children who have this type of arthritis will start off with having problems in their hips or their knees or their ankles. And one of the tricky things for many of them is they can have something that's called an enthesitis, which is a really tough thing to say 10 times quickly. But an enthesis is where a tendon inserts into a joint. So, for instance, at your elbow where your tricep tendon attaches right here, that's an enthesis. And so early on, kids may have inflammation of their entheses and will hurt at their heels or the bottom of their feet or below their knees. And it's not actually in the joint, but it's right around the joint. And that can be a first sign of this type of arthritis. It typically does tend to occur more often in males. There is actually a genetic marker, it's called an HLA-B27 marker, that is seen more commonly in people with this type of arthritis, but not everybody will have it. So what will happen is that you may have that early on, or you may have involvement of your knees or your ankles as the joints, and then as you get into your 20s or 30s, that you may have involvement your sacroiliac joints or your back or other areas as well. And it does seem to be a bit different disease. The flip side of it is that the medicines that we use for other types of juvenile arthritis work really well for this type as well. So even for a little slop in the diagnosis early on, we can get the right treatment going so that the child can get on with their business.
Dr. G, we just have a couple of minutes left, so if anybody has a question, please, now is the time, chat at wrgb.com. But, as we close, we talked about having really a great rapport with your doctor, your pediatrician, your pediatric rheumatologist, really having a good rapport internally, a plan, for the child and for the parents, kind of understanding your body, how it changes, how it feels. Something might feel different. But also there are other tools out there, such as arthritis.org or kidsgetarthritis2.org, that parents could be getting, the newsletter that Sonia just referred to. Outside of that, what would you, in closing, recommend that parents can do? Is this something a good rapport with the school district to let them know about their child's condition? What else would you recommend as we close this conversation?
Well, I think the thing about the school is extraordinarily important. Most people are not going to think about arthritis in children to begin with, and especially PE teachers, because, quite frankly, most kids are trying to sandbag them about being able to do things or not do things. So there are a lot of subtle things that will go on, and I think it's very important for the family to, when you have the diagnosis, to sit down with the school and get something that's called a 504 plan. And this is one aspect of special educational services, but it's not that you're going to go to a special classroom or anything like that. What this law does is it allows you to have accommodations and supports as needed. So if you need to do something about the attendance policy because your child's going to have morning stiffness and they're going to be late coming into school, you can rearrange the classes so you have a study hall first thing, and if you miss it, it's no big deal. You try to cluster the classes. If you have lots of books, that you get 2 sets of books, one for home and one for school, and things like that, so that it doesn't have the arthritis get in the way of the child making appropriate educational progress. And we also want to make sure that we are not stigmatizing the child too much. So I literally look at this as a disaster planning. These are things that may happen. So even if your child is doing well, you want to have this in place in case things don't go so well. So that's certainly one big issue. I think the other thing is, as you mentioned, this is really a team effort. And there's a concept called the medical home that the American Academy of Pediatrics has really pushed since the early 80s. And we're all working on this together so that it's not just rheumatologists doing this or just a primary care doctor doing that. We're all looking out for the child along with the family to make sure that we're covering everything and not forgetting any of the important issues in the child's lives. One of the suggestions I've been giving to families for years is, obviously keep track of what's going on with your child so that it's easier for you to explain things to the doctors. But now with having computers and everything, and storage devices are so much easier to do. What I've gotten from suggesting to people in the past to have a notebook of everything is make a Word document that sort of tracks along what's happened, and you don't have to have all the gory details, but you can have that and put on a flash drive, because if you ever have to go to the hospital or seeing another doctor, you can bring a flash drive and they say, what's going on? And you say, here, download this. And it helps a whole bunch from being repetitive, and helps you remember things better. And it also, again, helps demonstrate to your child that you need to keep track of all these things.
Well, Dr. Gewanter, I want to thank you so much for joining us in our debut webcast of You and Arthritis. We truly appreciate it. I know everybody watching appreciates it. I want to thank CBS 6 and just in their partnership with the Arthritis Foundation. If you want to view this, please join us on cbs6albany.com and join us this Saturday at the Jingle Bell Run up at the Great Escape in Queensbury to help all the children that we just talked about today. So we appreciate it.
Yes, thank you very much.
Thank you, and thank you, Dr. G. Okay.